Hey everyone, welcome to Only for Teens. Today we have on the program Dr. Netta. She's a psychologist who works in the South Beach area, and today we'll be talking about one of her specialties, ADHD. She also does her therapy in 3 languages, English, Spanish, and Hebrew, right?
Mm-hmm.
So thank you so much for being here on this program. It's really great to have you.
Thank you for having me. And just as a shameless plug, I think this is a great idea because it allows you to disseminate more information to teenagers and children in general about all kinds of conditions which they might not have looked up or known about before. So I think this is a great idea.
Thank you. So as I said, today we'll be talking about ADHD. The American Psychiatric Association states that approximately 5% of children have ADHD. And according to some studies in the U.S., they've estimated that higher rates actually might be. So starting from the beginning, what exactly is ADHD, Dr. Shaked?
Well, ADHD is actually a brain-based neurological condition, meaning that we know it's all in the brain.
Mm-hmm.
It affects somewhere between, like you said, about 5 to 8% of children. And it's a pervasive disorder, meaning it goes through life with you. Once you have it, you grow with it into a teenager, into an adult. So the estimate now is that about 60% of children who are estimated with 60% of children who are diagnosed with ADHD become ADHD adults too.
Mm-hmm.
It's a disorder that basically has 3 sets of symptoms: inattention, impulsivity, and hyperactivity.
Okay.
And there are actually 3 different types of ADHD. There's the predominantly inattentive type, there's a predominantly hyperactive type, and then there's the combined type.
Okay.
So really, when you look at ADHD, no 2 children or no 2 teenagers or no 2 adults that have ADHD will have the same exact symptoms. They present in very different ways in different people.
And is, just to clarify, is ADHD in general, including the 3 types, the same or different to ADD?
Well, ADD is an old term. We used to use it way back when we didn't know as much as we know now about the disorder.
Okay.
So really today we use the term ADHD, and ADD is sort of an antiquated term that we don't use anymore.
Right, ADHD is the modern correct term.
Correct, exactly. Because there's been so much research, we've learned so much about the condition. And I actually would like to share with you, if I may, the 3 different types of presentations so that your audience can maybe be more aware of maybe symptoms that they're experiencing or their friends are experiencing, and become more aware of the disorder. So as I mentioned, there's the ADHD that's predominantly inattentive, and some symptoms that people with predominantly inattentive might experience are not having close attention or details to tasks that they're doing, difficulty maintaining attention, and appearing not to listen. You might say to the child, "Do you hear me? Do you hear me?" Struggling on following instructions, having difficulty with organization, losing things easily and being easily distracted, or being forgetful. The hyperactive impulsive type is a person who might be fidgety, with their hands or feet squirming in their chair. They have difficulty remaining seated. They might be one of these types of people, you know. They might run about or climb excessively, having difficulty staying still. They might present as if they have a motor in them and they're running around constantly. They might talk excessively. You can't get a word in edgewise. They might blurt out answers before you're finishing the question, or they might not give you a chance to talk altogether. They might not have the ability to wait for their turn to talk.
Right.
And the combined type, which is the 3rd type, is a person that has both the inattentive symptoms and the hyperactive impulsive symptoms. So there are really 3 different presentations.
Okay, and are they all they're mostly genetic components that cause ADHD, or are there also some environmental factors, or does that actually depend on each type?
Well, actually, the whole of ADHD is a highly genetic condition. Highly genetic meaning that we now know that it's as genetic as height. Okay? So maybe your mom or your dad or your grandfather or your aunt or uncle or somebody in your family has these symptoms, and maybe they weren't diagnosed, but we do know that it's highly, highly genetic. There have been some studies about whether it's environmental, and the studies are not well accepted in the community in terms of having correlation with ADHD. So there's been some studies, I think, with regards to mercury and other pollutants causing ADHD, but the general feel is that it's a highly heritable biological condition.
Okay, and around what time do these symptoms begin? Is it the same for each type of ADHD, or is it generally the same?
For ADHD, the symptoms are always the diagnosis is that it has to be symptoms present before age 7. Okay. So, of course, some children, teenagers, and even adults don't get diagnosed before they're 7. But going back into the history, we can realize that they've actually exhibited those symptoms from age 7 and then on. So you have to show some kind of symptom before age 7.
And if it's after, then they believe it might be something else?
Well, if it's after, maybe then they weren't diagnosed on time. Maybe they weren't diagnosed properly. Or maybe just they never even went to see a therapist, psychologist, psychiatrist, or doctor who could otherwise have diagnosed them. Maybe they just, dealt with it and didn't get treated, which is a shame because ADHD causes a lot of disruption and difficulty in school, in social settings, at home. And if it's treated properly, with or without therapy and with or without medication or a combination of medicine and therapy, it can be quite treatable and it can make everybody's life a lot easier.
And would you say it's common for a lot of adults to be said that maybe they weren't diagnosed beforehand, but it's apparent that they do have ADHD, like today?
Well, now that sort of ADHD is in vogue and everybody wants to have the diagnosis or has the diagnosis or wants to be on the medicine that's used for ADHD, Adderall, and those kinds of medicines, a lot of adults are saying, wait, maybe I did have ADHD, maybe I didn't know, or maybe I think I have ADHD because I want the meds, which, is a problem because the meds that we use to treat ADHD with are being sold and given to friends and peers and family because they have side effects of keeping people awake and keeping people more focused.
They're sharing medication.
And it's a real problem with these meds. So,
right. And that can become very dangerous.
Yes. If you don't have somebody overseeing the amount of medicine you're taking and the proper dosage, it could be very dangerous. There are all kinds of problems. You could have heart problems. You could have anxiety and irritability from taking the medications.
Right.
You could have symptoms like tics, which are involuntary control of your body or your involuntary control of the sounds that you make. So there are all kinds of side effects that could be very dangerous and not so pleasant, and it's really important to have a doctor involved with medication for ADHD.
Right. And you said before that it can interfere with the teen's life in school and other things. Are there other things that it might affect a teen's life in, or any specific things having ADHD?
Well, the way we diagnose ADHD is we have to have severe impairment in at least 2 settings. And those settings that we look at are home, school, or another setting. So, obviously teens don't necessarily go to work every day, but if, let's say, a child was in a part-time internship, we would look at that as another setting. Are they having trouble there, focusing, regulating their emotions, prioritizing, concentrating? Are they fidgety all the time there? So we would look at that as another setting.
And what would you say, are there any common misconceptions about ADHD, about having and living with it, and what are they?
Interestingly, recently there was a book written about, and it was published in the New York Times, about whether ADHD is even a real disorder. And the research community is, discussing this question a lot. But the research that I've seen by prominent researchers from Harvard and from other very acclaimed universities does support that it's a real condition and that it's a real disorder and that people do and are impacted by these symptoms. That being said, there are people that think that they're ADHD just because it's cool to have ADHD now. It's the in vogue disorder.
Right.
So, it's important to get diagnosed properly and to make sure that you're really diagnosed with ADHD as opposed to another condition, or maybe sometimes people have two conditions at the same time. ADHD is a condition that's very common in terms of having a coexistent condition. So you could have ADHD and depression, ADHD and anxiety, ADHD and oppositional defiant disorder, and a bunch of other disorders as well.
And that happens a lot?
Yes, it's very common.
And what you said before, I find that interesting about people kind of doubting whether it exists. Do you think that sort of has a connection between, the doubt and many people wanting to have it? So they see that a lot of people think it's cool to kind of have ADHD, and then they start doubting whether it's actually real. Do you think there's kind of a connection between that and the doubt?
Sure, I think so. I think that's one reason. I think the other reason is that, the medication is such a highly medicated disorder that people and physicians, parents, researchers are starting to question whether we're overly medicating children. And with that, we're questioning, are all of these people really diagnosed with this condition? And then that raises more questions. So absolutely, I think there are multiple reasons why that could be.
Right. And then if a parent thinks that their child, their teen might have ADHD, what should they do as a parent?
Well, first of all, they should absolutely go see a well-trained clinician, a psychologist, a therapist, a social worker that absolutely has expertise in ADHD. If you don't have expertise in it, you're not going to be able to diagnose it properly. And ADHD is not so easy to diagnose because, as is what we talked before, the symptoms have to be shown before age 7.
There are 3 types.
Yeah, and even, imagine, let's say you're 14. You don't necessarily remember how you were behaving when you were 5 or 6, but your mom or dad or your uncle or grandmother might. So it's complicated to diagnose. We don't only rely on the child's report or the parent's report. We also need to get confirmation from the child's teachers, from their camp counselors, from their pediatrician, from their maybe football coach. We use a lot of different sources of information to see whether these symptoms are really pervasive in different environments. Because as we said earlier, the symptoms have to be present not only at home, but also at school or at work or at home, school, and work.
So it's a very complicated and serious process.
But once diagnosed, it helps because now you know, and now you know how to treat it. Otherwise, you don't know, is it anxiety, is it depression, is it bipolar disorder, is it a sleep disorder? So once you can finally figure out what it is and hone in on that disorder, it helps.
Okay, well, thanks everyone for watching part 1 of this program. I hope you found it interesting, and I hope you learned something new about ADHD. I know I did with the few different kinds you said of ADHD.